patient that has intestines in the lungs and the chest instead of where it's supposed to be, or severe oligohydramnios. Okay. No, so we have discussed what happens to the physiology. We're not discussing physiology. I talk about all the physical things that can happen. Now, what are the physiological things that can happen? Okay, I bet the right ventricular pressure is equalized with the left ventricular pressure. Okay, let me ask it this way. In the room, which of the part of the heart is in charge in utero? Which part of the ventricle is doing more work in utero? Left. Okay, there's a division now. So how many people say right? Raise your hand now. Okay, yes, they all have it. And I that thing. How many you say they? How many people say nay? They yes have it. And whether we count it or not doesn't matter. So in utero, the right part of the heart is doing more work than the left part of the heart. But once you are born, the left ventricular pressure and the right ventricular pressure equalizes. Okay. Now you change the type of the muscles or structures of the muscles of the heart. You have more increase in connective tissue to contractive tissue in utero as the baby is being born. Then you have the Stelling curve, which I don't want to discuss, and all some of these things. Then in the lungs, what happens to the lungs? In the lungs, some people think that once you are born, your lungs are fully developed, and they taught me in medical school that the lung matures at 34 weeks, isn't it? I don't know about you. Is it only me that at 34 weeks the lungs are matured, the baby can come out? But the bronchial tree is not fully developed and does not get fully developed until how many years of life? 8 years of life. Okay. The alveoli develop after birth, but the branchings have not completely developed. Okay. The baby has very compliant chest wall, and also the diaphragmatic breathing, and there is less response to the partial pressure of oxygen and partial pressure of what? Carbon dioxide. Am I too fast? Okay, so let's move. Okay, now what are the things that happen in the respiratory system? Pay attention here. How many people know that the head of the baby is the largest surface area in the baby? The head of the baby is large, and the neck is what? Short. That is why, as my chief was talking about, how you position the baby, very, very important. Some people put, I don't know what they put in your center, but they put that delivery, that pad that women use. And the baby is like this. And I tend to ventilate the patient. Baby's neck is like this. What happens when the baby is like this? Your ventilation will not be what? So if you say, why is it that when you come and bag the baby, the SpO2 will be 99%? So when we bag the baby, SpO2 will be 70%. How many of you has it happened to? Oh, I'm alone. Maybe it has happened to my chief. How many of you, there are some nurses, once they bag the baby, you know the baby will do what? Will die. Yes. And that time we didn't have mechanical ventilator, so it was a quarrel. I'm back for 2 minutes, I'm back for 1 hour. Oh, is it? Am I not in Nigeria? Yeah. There's a quarrel who is going to bag the baby, whether it's house officer or nurse or registrar or senior registrar, who will bag the patient. Because position of the person have not understood that the neck of the baby is what? Very short. So you can easily occlude the airway of the patient if you don't position the patient well in a sniffing position. So when you bag a patient, ask yourself, which position is this baby? Is it hyper-extended or hyper-flexed? And is it on a sniffing position? Because the neck is very, very short. The occiput is very prominent. That's where they come out from, isn't it? This is the occiput, very prominent in babies. The spine, the chin, all meets the chest because the neck is very what? Short. All right? The tongue is large and occupies the entire oropharynx. The tongue of the baby is very, very large. I'm sure some of you are smiling. I've seen the answer to your questions. Now, if the babies don't, have you seen babies that have a lot of teeth, have complete teeth? No, babies don't have teeth. And that predisposes them to airway obstruction because the teeth acts as like a physical barrier. All right? So let's move forward. Now, this is a diagram of what I just talked about. Okay, can we pay attention? Please, let's look up. Look up, eh? Look at that. Look at the adult upper airway. Look at a child's upper airway. Now, look at the size of the tongue of this child. It's almost occupying the entire mouth of the child. Now, look at that of an adult, maybe about 2/3. But the child is almost everywhere. Look at this, the posterior part of the tongue. Are you seeing that of an adult? Are you seeing it? Look at that of a child. It's almost everything is occupying. Now look at the pharynx of an adult. Are you seeing it? Now look at that of a child, very narrow. Are you seeing it? Pharynx is very small. Look at the epiglottis of a child, an adult. Look at how large and floppy the epiglottis of a neonate is. Are you with me? Should I take it again? From the picture, the tongue is what? Large and occupies almost the entire mouth. Now, the pharynx is what? Smaller. The epiglottis is large and very what? Floppy in that on babies. And then the larynx is more anterior and superior. Please, anytime you are intubating a patient and you just put your whatever and it just goes like that fast, you are not where? You are not in the airway, you are somewhere, you are in the esophagus. Because the larynx is more anterior and what? Superior and smaller. Okay? Now, its narrowest at the word cricoid. I'm sure this is your question. The area is narrowest at where? The cricoid. The trachea is narrow and less rigid, unlike this one that is trachea is large. So these are the difference in the anatomy of the child and that of what? An adult. Okay? So let's move on. Babies are obligate nose breathers. How many of you saw it? Your question. They obligate mouth breathers. Because of the close proximity of the epiglottis to the soft palate. Mouth breathing can also occur where? In babies, but it occurs when they are crying. Are you with me? Now, this is our food. We start a bit.